So I give the welcome. Of course, it's my pleasure to give the last massive lecture of the entire fellowship for the second. You all saw these questions last year, not you jokers, but this is, I've been doing the same exact lecture for 8 years, and everybody's like, why? Nothing changes, okay, except for some serology tests here and there, some novel drugs here and there. For the most part, it's still the same. Albendazole is still the same. Everything is the same. The only thing that really changes is malaria. And so this is 2 PowerPoints that I give in sequential order, but I do this in board style questions. So if you have questions, Ribble, why are you so far away? Ribble's like, I already know this. But this one. But all joking aside, this is like board style, so it will help you with your boards. There are some things, there is some trickery. I do that on purpose. But it's important to understand that everybody freaks out about these questions. It's 5% of the board. But they're easy questions. You should be able to look at it and go. Look at it and go. Look at it and go. The stuff that's tough on the boards, like I told you all when you started, is the hospital epidemiology and the antibiotic stewardship. Everything else is kind of fair. Those things are tough because they involve math. Okay. Yeah, math. Okay. Ready? Let's begin. There might be some typos in here because I try to fix it, but then I always do this late at night, and that's a bad idea. 34-year-old man from the United States presents with high fever and rigors, happening every 48 hours after about a week. His wife reports recent confusion and headache. He returned from a month-long safari in Africa. He took doxycycline for malaria prophylaxis. Past medical history includes Wolff, Parkinson White, status post-ablation, inhaled tobacco, and a 15-pack-year history. Some of these are real cases. Some of these are kind of made up. Physical exam. Temperature 40.2 Celsius, heart rate of 122, respiratory rate 30, blood pressure 149/60. He's got injected conjunctiva, tachycardia, few petechiae on extremities. Again, you can see that the Microsoft, the Apple sucks. So he's got 13,000 white count with a left shift, crit 33, platelets 80, retic is 4%, creatinine 1.2, AST and ALT are elevated. We can't say transaminitis anymore. Chest X-ray cephalization of fluid is noted. He was DC'd. Sent home on Topical and Poguano.
Oh, God.
12 hours later, he returns via ambulance after being found obtunded. CT had multiple areas of infarctions. What is your next course of action? A, order PO chloroquine. B, order an exchange transfusion. C, order IV quinidine and PO doxycycline. D, call the CDC at this number and begin IV artesunate. Now, the second year should know the answer to this. So we'll kind of go with the first year. What do you all want to do? And no, you can't call me. Why second year's concurrence? Is the honey bun good? That's all that matters right now. It is D. Why? Why is each one wrong? This is the point of how you study for boards, ladies and gentlemen. It's not just about knowing the right answer. It's knowing what's wrong. Why is A wrong?
Resistance. Likely has falciparum from Africa, severe falciparum, even the fur on presentation.
Is anyone answered yet?
Quotes to begin with. But pure chloroquine will not be used because of high rates of
Okay, in sub-Saharan Africa. What about B? Oh, and Becky, I know you're over there at in Tampa General Jail, so if you want to comment, go ahead. What about an exchange transfusion? Why is that wrong? Okay, why? What?
No proven benefit.
Right. It actually hurts patients. It actually hurts patients. So you can't do it. It's bad. Okay. What about C? Why is C wrong? The pharmacists know this in the room.
First of all, the patient was already on doxy for prophylaxis.
That's irrelevant.
And I'm guessing
What? Well, I mean,
Wouldn't use that to treat like a cerebral malaria.
you could, but why? Why is it wrong? No,
Has to do with like a drug interaction.
negative.
That's to do with the high
The
parasite
wolf
burden.
Parkinson,
No.
right?
Oh, well,
What?
The wolf Parkinson, right?
Negative. It's already ablated. It's done. Cardiologists will freak out, but that's not your problem. You have to save the patient. IV quinidine since 2019 is not available in the United States of America. So,
Anyone? Any other reason?
so it's not available. And so you can't use it. It could be on old board questions on purpose to mess you up. Okay. Now, IV artesunate is now. Anyway,
For next.
so I haven't changed it yet. IV artesunate is what you use. Now there is some counterfeit artesunate in Central Africa, okay, especially in the Congo countries, right? The countries that border the Congo River, and so that's a problem, okay. And usually those, it's usually Coartem that they use. That's oral. That's really a sugar pill. All right. Now, read the point about the boards also is reading the question correctly. Which of the following prevents against acquiring malaria? A, lack of Duffy blood group. B, sickle cell hemoglobin heterozygosis. C, erythrocyte membrane proteins. D, A and B. E, none of the above. E, who said B?
Is it, I'm confused, heterozygous or some kind of sickle cell?
Trait.
I thought it
So
it doesn't
trait,
prevent
no?
it, it should makes it less severe.
Yeah.
So what is home? Okay, so let's go back. So, okay, let's say the right answer. It is E. What prevents you from getting malaria? Getting bit.
Yeah.
Not
Yeah, not getting bit. Okay. And so, you know, that's what prevents it. These things help you not die from it. So, lack of a Duffy blood group, what does that prevent? Vivax. Okay. Sickle cell hemoglobin heterozygosis. What is that? Trait.
trait.
So, if you have hemoglobin, you know, if you have, it's, you know, if you're homozygous dominant, I'm sorry, recessive, you die. That doesn't help you, right? If you're, you know, homozygosis dominant, then those patients obviously can get it because they can't form sickles. Erythrocyte membrane proteins, all of these are, and they can prevent a lot of, you know, severe disease because of it. But nothing stops it except for not getting bit by a mosquito. True or false? Thick smears are used to determine percent parasitemia. You either know it or you don't. Are used to determine parasitemia. She says thick smears are used. False. So thick smears are used to determine whether or not it's there. Thin smears tell you morphology and the percent parasitemia. Okay. Now I know everybody's like, well, where's the Binax? Well, fine, but not everybody has Binax. Talk to the Moffitt people; they don't have it. Why? I've asked for it for a patient who was from Sudan in Haiti, and I thought had malaria while I was on call, and everybody looked at me here like I was a complete alien. You have to think about malaria all the time. Okay. Which of the following statements is true regarding malaria prophy and treatment? A, prophylaxis should be taken 1 week prior and 6 weeks after departure to an endemic area. B, chloroquine is the drug of choice for travelers going to the Caribbean and Amazon. C, doxycycline is well tolerated despite its side effects. And D, methylquine is well tolerated. It's first line for prophy. Again, for board questions, ladies and gentlemen, there's going to be 2 that are easy to get rid of and 2 that are going to drive you nuts. That's how it goes. No matter if it's law school, pharmacy school, dental school, you know, or program director school. It doesn't matter. It doesn't matter.
Okay, which one can
Come
we
on.
eliminate? A, thank you. A for sure.
Why? Don't just say no. Tell me why.
So, class depends on what.
Which one, yeah.
Yes, duration depends on which one.
Right.
Prophylaxis.
But for the most part, it's usually 72 hours and then up to 30 days. Okay? You don't need 6 weeks. You only take it a week before unless you're insane. Doesn't matter. Okay. So what else is right and wrong here? No, why? That, but what else? Yeah, the last thing you want to do while you're on safari, like Ribald going to crazy places and staying with tribes and stuff, is you don't want to have fever dreams. You don't want that. That's not a good idea. It confuses the not only what could be malaria, but also could be other infections. What else?
I'm guessing there's chloroquine resistant.
Yes.
Yeah, is it the drug of choice?
Yeah. I think atropicone program is the first line choice.
Chloroquine is the right answer.
Oh.
Why is he wrong?
So it's not wrong. It's just not the best answer. So it is well tolerated, but is it? So there was a massive episode in Afghanistan when a bunch of GIs who were over there, okay, were in the valleys. That's where malaria is, not in the mountains. And of course, they have cell phones. Should they be using it? Probably not. But they were, and they were all on Doxy. Guess what? They all got malaria. Why? Afghanistan has a hot, really bright sun, and people were getting sunburned. And they stopped it. They all got malaria. All the Marines. I mean, it's unbelievable. How do I know this? Because we used to have conference with them at San Diego. And so this was a problem all the time for them. Chloroquine is still susceptible in the Caribbean for P. falciparum. But what is the dominant?
Which one?
Which one is the dominant species in the Amazon and parts of most of the Caribbean? Vivax. Now, would you use primaquine with it? Of course you would. But at the same time, chloroquine is used as the main drug.
Also, pill-induced esophagitis does happen. My mom got it when she took it.
So here's the malarium takeaways. Okay, I told you this ad nauseum. It is our ST elevation MI. It is our code stroke. Okay, if you don't go see the patient, I will find you and kill you. But more importantly, it's really important that these patients can die and fast. The 19-year-old that died 2 years ago here was unfathomable. And the fact that we had to have an M&M on it, and we couldn't say who messed up, was awful. I yelled at everybody on that thing, and I'm like, no, this is serious. So, Plasmodium has 4 human species, 1 simian species. What is a simian species? Yeah, why is it important for Ribald to know this? That's where she's going. So she's got to know what Knowles-I is. It acts exactly like falciparum, okay? Erythrocyte dyscrasias are meant to prevent severe malaria, not frank infection. Again, thalassemia, all of these wacko things that we deal with, that all is part of it. IV quinidine is no longer available. Use of artesunate is recommended, even though there is some resistance to it now, mainly out of Southeast Asia. Okay, well, because it's used ad nauseum there, crazy, and you can't just do that. So what ends up happening is that then you start having resistance. Where do you get this drug from? It comes from the bark of the yew tree. Where is that from? Southern China and parts of the Indonesian peninsula. And so that, when it comes down to it, these people have been chewing that or making a tea out of it for thousands of years. It's only becoming now because it's all over the place in the pharmacies. Prophy, of course, doxy, minnow, atovaquone, proguano, mefloquine. You can use mefloquine, it's just not ideal. Okay. Primaquine has one bad side effect. What is it? It was on all my medicine board and my ID board. Yes. So it can cause, right. So it causes an anemia that you have to treat really, quickly.
Also G60, right?
Yeah. So here are the smears. So this is a thick smear on the left. And again, you just see that they're there. Okay. And the thin smears are on the right. Do you all know how to make these? You need to know how to make these. If you go down to your micro lab, they need to help you because it's really, really, really important that you know how to do it. Why? Because you're going to get some path tech in the middle of the night. It's not going to know it. And they're going to say, we have to wait for the pathologist. Pathologists are they on call, really? I mean, they are, but they're not going to come in. And so do you have Binax? Maybe. Why? Because you can, it's like the third biggest killer in the world. They had that whole Ebola thing and, 2014 and 15, and everybody was, oh my God, all these people are dying. Most of them died of malaria, not from Ebola. Can I move on? Question 5. 35-year-old Caucasian woman seen by a physician recently after a trip to rural Virginia, like I was at 2 months ago, with erythema migrans. She was given doxycycline. Now she has fevers every 48 hours, which is an undulant fever, as you said correctly at the dinner, and myalgias. Gibbs stain of a peripheral blood smear is shown, which is true. Doxycycline was the most effective drug for this patient's Borrelia infection. B, atovaquone and azithromycin is a regimen of choice. C, this organism is transmitted from the white-footed mouse by the exotic tick. A, splenia can cause a life-threatening parasitemia. E, all of them. That is correct. So what is it? Babesia. So what happened with this? Why did you even put Borrelia in there? Same tick. Same geographic location, same host. Okay. And notice if you see, I have the Maltese cross there. But again, that doesn't mean that it always is there. So on older questions, they might call this American malaria, which is dumb, because there is malaria in Western Hemisphere. We are in the Americas, but still, you might, and some older physicians might say that. 6, 13-year-old child visiting from Bolivia. Oh yeah, you will see some pediatric questions on the ID board. Visiting from Bolivia is seen when clinic with a swelling from the left eyelid. Which of the following is true? Okay, A, a UA should be done to check for proteinuria. 2, this is Romania's sign and is indicative of entry of a parasite via the conjunctiva. 3, the causative organism was transmitted by a reduvid bug. 4, nifurtimox is not an effective therapy. 5, 2, and 3. What is it? Okay. So why is 2 and 3 correct and the rest wrong? You tell me.
That is Romania.
That is Romania sign, yeah.
That is transmitted by the reduvid bug. Nifurtimox is an effective therapy, although it's not the drug of choice in most cases. Bentonidazole is preferred.
But it's still effective in the acute.
Yes.
In acute Chagas.
Yes.
Okay. And then what about 1? Exactly. Doesn't really help you, right? And usually you could see that in later part, in the chronic Chagas, when it could get to the kidney and other places. Okay. Which of the following is true regarding? Okay, they're also not going to have least not questions. Okay, except questions. I have 1 or 2 in here. I do that on purpose to make you think, but that's not how the board works. Which of the following is true regarding infection with T. krusei? A, complications include megacephalus and megacoma. B, the heart is the most commonly affected organ in chronic Chagas. C, treatment of chronic Chagas is a low success rate. D, diagnosis is made by identifying trypanosomiasis on Gibbs stain in the peripheral blood. E, all the above. Okay. You're like, oh, there's your easy, Anthony. Okay, that's true. But there might not be. But a lot of the parasite questions are. Don't get confused. You could identify the Gibbs stain. Somebody in this room did that last week. And so you can, it's not hard. Again, you have to know what you're looking for. Question 8, 19-year-old man visiting from East Africa is admitted to the hospital 2 weeks after his arrival from John F. Kennedy Airport. His parents complain that he has been somnolent and has had occasional tremors. Peripheral smear is shown. Which of the following is true? 1, organism is transmitted by the black river fly. 2, melosoprolol is an effective treatment for the first stage of the disease. 3, black river flies are attracted to light-colored clothing. 4, East African form is worse than the West African form.
I remember picking Malaria.
Yeah, it's rhodiense or gambiense, 1 or 2.
Ours, I have
It's not 1, it's not 3.
It is 4.
It's 4.
What is 2? What is one? What is number one? What's wrong with one? Tsetse fly. What's the black river fly transmit? Right, Onchocerca, right? The worm. Okay. Mesoprolol is an effective treatment for the second stage of the disease, not first. Okay.
That's tricky.
Now, 3, black river flies are attracted to light-colored clothing. No, remember Livingston, I presume. Everybody wears tan, not because it's fashionable, and not because it's part of the devil wears Prada. It has to do with the fact that these flies bite large herbivores in Africa. What are the color of most large herbivores in Africa? Dark, whether it's charcoal, black, or dark gray. Okay. Now, that's why they tell you not to go out there wearing Zara. They want you to dress like you're in safari for a reason. Okay. Now, East African form is what? Rhodensiense. What is the old Rhodesia was the old name for what country? Zimbabwe. Right? That's worse. Gambiensis, which is from the west part of the continent, is the river Gambia, right? Which only is around, or the Gambia is only around the river Gambia, right? And Senegal is all around it. And you're like, why do you know all this? You have to know geography. If you don't know geography, you're in deep doo. Okay, for this test, for this part. So let's compare the two. Trypanosomiasis. You have Chagas and sleeping sickness. You have African trypanosomiasis and you have American trypanosomiasis. So both have acute and chronic forms. Chagas is actually all over the Western Hemisphere. It's not just south of the border, okay? It's in North America, or at least the northern parts of North America, okay? So acute treatment, benzoyl. Chronic, none. Nifurtimox can be used. Visceral organs are affected. Reduvid bug is the, or assassin bug, okay, or triemterines. How do you get infected? Tell me, enlighten me.
They defecate. They take a blood meal and they defecate, and it's transferred.
You scratch scratch the feces into the capillaries. Now, the Romania sign is because it's like, because it affects right around the eye. But why around the eye? Was usually your face is not covered when you're asleep, right? Unless you're like Bowen and put the covers over your head. That's not how it works. So, right? So that's usually why it happens there. Right? And these things, and they have mud huts, right, in parts of South America. And so, right, and so, and mud can be warm, and so they make holes in the mud to stay, and they actually are hunting other insects. Is what they're really doing. But if you're there, hey, you're delicious. So here we go. So sleeping sickness, acute versus chronic form, same thing. Sub-Saharan Africa, rhodesiense is way worse than Gebi. Okay. Treatment is again pentamidine, sermon. Chronic is eflornithine. It's a terrible drug. Nifurtimox, mesoprolol can be used for both therapy. Tsetse fly is the vector. Now, I had a point and I just lost it. Crap. There's usually a 3 to 4 week period between the acute and chronic form for African sleeping sickness. So that's kind of important. All right, you're excluded. Find the kinetoplast. If you find the kinetoplast, you can tell which one it is. Which one of these is? Oh, this is the point. So for the African trypanosomiasis, is Trypanosoma brucei, subspecies Gebiense or rhodesiense. It's not. That's not the species name. It's a subspecies name. Okay. There is only one T. cruzii. Now, find the kinetoplast, and you can tell me which is which. Wait, let's look at the first years. Which of these is T. cruzii? Owen's like, what? I just go to a Peruvian restaurant. Tell me.
I don't know. I'm gonna guess the left one.
Okay, second years, tell them.
Yeah.
The left is which one? Dave?
I can show you a picture.
Christ. As Sandy Golf would say, good grief. So look, here is where the kinetoplast is in T. brucei. In T. cruzii, it's all the way at the point, all the way at the end. It's very axial. Nothing else looks like this. You can and again, and they're usually shorter. Yeah, the one on the right. The one on the left is T. brucei subspecies, whatever. And so you have to find the kinetoplasm. What is a kinetoplasm? Kinesios, Greek. What does the word mean? Movement. Everything comes back to Latin or Greek, like Srinath pointed out at the dinner. Like you didn't go to Sanskrit. Bottom line, that's what makes it move.
So kinetoplast in the crown. Crucii, crown.
Look,
Yeah, I see.
look, there's a space here.
Yeah.
There's no space here. Everybody should know this question. You've all read my paper, but this is important. Question 9. This is an actual case that I wrote. 5 East African men present to the ER from ICE detention with painless lesions on different parts of their bodies. Upon further questioning, the patients took a route into the U.S. from Eastern Europe through Cuba to Ecuador, through Central America to the U.S.-Mexican border. They spent the night at the Panamanian-Colombian border where they were bitten by small bugs. These are the lesions, okay? All had lymphadenopathy proximal to the lesions. Okay? The one on the bottom left is 8 centimeters in diameter on the back of a calf. After biopsy, which is the most likely diagnosis? New World leash, Bruley ulcer, Old World leash, cutaneous system.
It's America, it's right. The America is right.
East Africa.
But
But you were bit at the border.
they were both bit at the Panama-Colombia border.
The devil's in the details. Like I said somewhere else in some conference. The devil's in the details. If you notice, again, I saw this on call as a first-year fellow. I knew exactly what it was. I'll tell you the story some other time. But those small bugs were sandflies. Okay. And it was New World leash. What is the reason behind using liposomal amphotericin B to treat leash? A, Leishmania is really a fungus. B, Leishmania have ergosterol in their membranes. C, Leishmania have beta-glucan in their membrane. D, Leishmania have their mastocytes rupture within their macrophage and leucoplasm. I love Celia's face on this. She's like snarky laughing. I love it. All right, first years. What's the right answer? Oh, God. Oh, geez. Mind you, in front of an attending who's here, uses lipoamphotericin B all the time, and the pharmacist who probably regulates on everybody trying to use it. So you all better know this for 2 years or a year of fellowship.
Is it B?
Fernando. Okay, so we have a vote for B. I think it's Fernando. I hope it wasn't.
It is.
I hope it was. Well, I don't know. It could be. I mean, who knows? It could be. It could be Montero.
It could be.
So it's B. B. What else? What do y'all think? Come on, guys, answer. The clock is ticking.
He was the one that was kind of enticing for me to.
Okay,
Yeah, you see.
I made it up. There's no such thing as an oligoplast. And you're like, why would you do that? You're not going to do that on the board. No, but you have to know when they're feeding you crap. I made it up. It doesn't exist.
The mastigos do exist, but not the.
Yeah.
They do rupture, but they rupture where? They're usually either in the rough ER, smooth ER, or they're in a dead phagolysosomes. Okay, so it could be all over the place. Now, they do have ergosterol in their membrane. They're not a fungus. They are a protozoa. They're part of Apicomplexum, which is the same group that has Plasmodium, Toxo, okay, and also Babesia. Okay, so they're all part of the same group, and also some of the diarrheal diseases. Okay, like cyclospora. They do not have beta-D-glucan in the membrane. Fair? This tells you have to know the pathophysiology, ladies and gentlemen. You can't just make it up. Don't get distracted by crap. This is the life cycle. Okay. Notice, you get bit by a sandfly. There's two types of sandflies, phlebotomus and Leishmania. Phlebotomus is in old world. Leishmania is not really a sandfly. It's a tropical fly. Why? There's some deserts in South America, but they're really, really south. Okay. Sandfly doesn't exist there. It exists in the tropic. It actually exists in the jungle. And so anyway, so the sandfly takes a blood meal, injects the promastogotes. They find a monocyte. That monocyte goes somewhere, and that's where the disease starts. Okay. They rupture the mastogotes, the cycle continues, and then from there, a sandfly takes another blood meal from an infected patient. It ruptures inside of their gut. The mastogotes then form this promastogote. They go to the proboscis. What's the proboscis? I don't know what this is. I'm kind of fuzzy on
The
this.
needle in the mouth.
Yeah, the nose mouth parts thing. And what happens is that they inject the proboscis into the skin to look for a capillary. When they do, they inject their saliva, right? What's in their saliva? Anticoagulant. And in the saliva glands are the promastogotes. That's how the cycle is complete. You understand? Mosquitoes do this. tsetse flies do this. Other flies do this. Other bugs do this. It's all, except for the reduvid, it's all inside the salivary gland. Okay. So old world and has phlebotomus, causes visceral disease. Kala-azar, that fever, once it gets into the visceral organs, it causes a mess. New world, Leishmania, you are responsible for vectors. Sorry. The Leishmania causes mucocutaneous disease. You can see cutaneous disease in both. They're painless lesions. Okay. Don't forget, visceral disease, you will see hepatosplenomegaly. Amphotericin B works, not great. Azoles works, kind of. Antimonials, what's antimonials? What are those? Yeah. Remember the periodic table? Right? E falls under oxygen. Falls under oxygen. All the way down. It's a heavy metal, it's liquid. Okay. So SB is the designation. I think it's sublumum is in Latin for you. Resistant in South Asia, mainly susceptible in Africa still. What are the problems with antimonials? The pharmacist cannot answer. Okay, yeah, okay. So is Steppenwolf. What's your point? Metallic. Like what? What happens? Toxic. I like that. Toxicity. It's bad. Thanks, Dave. What does it do? Arrhythmias. Arrhythmias. That's what it causes. That's how it kills people.
Even if it's administered locally?
Yeah.
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 You will give that as an option on the test.
You could. And that's why I'm going over all this stuff, because who knows? Right? And the parasite questions, when you go to the boards and you listen to Jack Bennett, these guys, nothing changes. But there is a change. Miltefosine, which is used for PAM, okay, can also be used for Leishmania, funny enough. And it is oral. Montero has it somewhere in his desk at Tampa General. Okay. It's not at every hospital, but the main academic centers should have miltefosine. So not only is it can be used for PAM, it can be used, right, for this. You have to get it to the CDC is kind of tough, but most centers should have it. Question 12. And stop me if you all need a break. 45-year-old man presents with 5 days of fever, chills, abdominal pain, hematochezia. He returned from a trip from Mexico 2 to 3 weeks ago. He has not been able to take PO and feels weak. Vitals, 39.4. Heart rate, $114. Respiratory rate, 24. Blood pressure, 90/65. You order IV fluid and stool exams. What did you expect to see, A or B? Easy. What? Or Brenda could tell you the answer. Okay.
Yeah.
So the second one is diarrhea.
It's
Wait a minute. What is the syndromic diagnosis? Again, sorry, last time you will hear it. What is the syndromic diagnosis in this patient? No, madam, I'm talking about the actual just symptoms. Yes. Remember from Oregon Trail, you guys are too young. Jason died of dysentery. Okay, right? Okay, it's fever, abdominal pain, and poop and frank blood. That is dysentery. Does Giardia? No.
Also, Giardia's a little bit more subacute, no?
It can be, but it can also be raging. Tell somebody who's going to Machu Picchu and drinks, river water, like one of my colleagues did, and had a really bad experience. So let's look at these two things. Okay, what is inside the Trypanosomiasis? What are those things? Right, well, tell me. No, I know that, madam. This is the trypanozoite of an amoeba. What is inside of it? No, it forms a cyst. What are those things? They're round. No, they don't have eggs.
A kiloplasm.
It's not a lethal It's in the syndromic diagnosis. Erythrocytes.
Oh.
Very astute, madam. So what it does is it actually makes a hole between the M cells, right, and the enterocytes. It actually starts to chew through them to find a capillary. Why? Why does it want red blood cells? Iron, as they say in the cell. Iron. They need iron. Everybody wants iron. And so it's sequestered on purpose. It needs it for part of its growth. Giardia, does Giardia cause dysentery? No. What does it cause? What is the syndromic diagnosis? Oh, thank you. Now you're just attacking me.
Yeah.
No, it is a secretory diarrhea. Why? Yes. It detects something foreign. It's just eating off of the food debris. What are those eyes? Is it looking at you? What are those things? Suckers. Celia's been studying. I'm impressed. Right? They both form cysts to be a little bit more resistant to, chlorination and all this other stuff, and other things. But for the most part, when they exist like this, those are suckers to latch onto the enterocele. For you to say that is unbelievable.
Looks like it's staring at me.
Yanina was nice for the first time ever. Okay. Protozoa. Dysentery. And it's okay. It's our friendship. Okay. Entamoeba histolytica versus Giardia lamblia. So there's dysentery versus a watery secretory diarrhea. Entamoeba feeds on erythrocytes to find the iron source. They're both fecal oral, right? Again, I already said that Giardia feeds on food debris. Metronidazole is the treatment of choice. You can't use paramycin which is aminoglycoside, right? For entamoeba, it's not great. You can use it for asymptomatic patients. But for what you have to know is that there are cases of resistance. That's really important. Okay, and they could ask you.
Doing that in those situations.
That's a good question. The jury's kind of out. I mean, there are other nitazoxanols that you can use that are novel. But again, in these places, what's the most important thing? Don't get infected. How do you not get infected with Giardia?
Bottled water.
Well, you got to make sure when you're drinking bottled water, you have to make sure the teeth are latched on that plastic. 1, 2, again, like I would say, agua con gas. Okay, so water with gas, mineral water, like Yanina drinks. She's not trying to prevent dysentery, but she just likes it. But water with bubbles helps. Also beer. So when I tell patients to go on safari or whatever, beer actually is very good. Why? It's carbonated, it's pressurized, okay, it's sealed, and organisms really don't like to be in it. And you're like, well, we're going to be gobsmacked? No. But if you want something cool and refreshing to drink that's not going to get you sick, beer is a good option. Also, taking bismuth into the bush is a good thing too. right? Every time I went to Iquitos in Peru, or I would go to Haiti, wherever I was going, I always took Pepto-Bismol with me, tablets. Liquid's kind of messy. But this way you can eat and kind of be a little bit more adventurous. Fair? All right. We're going to go through the rest of the enteric protozoa quickly. No questions. Cryptosporidium. Again, these are part of Apicomplexum, related to Toxoplasmodium. Notice the diameter. This is why micro is important. Okay? 5 to 6 micrometers in diameter. Okay? As John Tony would say, those are microns. Okay? PAS stain. They're positive on them. You can kill them with chlorination, but it's a real problem, okay, these days. Ozonization really works, but in 2020, what happened? COVID. So a lot of different water plants in different cities stopped using ozone because they had to divert that towards the oxygen requirements for the country for vents. So this started to become a problem in the last part of the decade. Causes the watery diarrhea, immunocompromised way greater than immunocompetent. All right. There's no real. You can use nitrous oxide, but it sucks. When do you see it? Farms, water treatment, childcare, hikers, outbreaks. So there's a famous outbreak that happened in 1993 in Milwaukee. The city of Milwaukee decided to stop using high-dose chlorine for their water treatment. Several hundred people with HIV infection died of Cryptosporidium. And it was a catastrophe. I want to say something else. Okay. So you could see this on the board as a question. Cyclospora, discovered in Peru in 1990 by Bob Gilman and Eduardo Gattuso. And it causes the watery diarrhea. It's bigger, 10 micrometers in diameter. So almost twice the size of a red blood cell. All right. Again, immunocompromised, more than immunocompetent. What's the treatment? Cotrimox. All right. Same places. Farms, water treatment, hikers, outbreaks. Last time we saw a big outbreak was in McDonald's when there were salads and they had raspberries in it. All were infected with cyclospora. Thousands of people got sick. Yep, wash your fruit. Cystoisospora, as it is known now, used to be called isospora. Wow, that kind of looks like a gametocide for Plasmodium, doesn't it? Derp, because they're related. Okay. Again, apicomplexum, watery diarrhea, 20 to 30 micrometers in diameter, huge. What else? There's only 2 things larger than this that you will see, besides actual bugs and worms. What else for a one-celled organism is this big? 2 things. Balantidium, okay, coli, which is not really an infection. We'll talk about that briefly. What else? Coccidioides. The spherules are massive. Those are the only 2 things that are bigger than this. Treatment is what? Yeah. Again, same things. Farmers, water treatment, hikers, outbreaks. We usually see this more with alfalfa. Not the character from Little Rascals. It's not that. Actual alfalfa. Mainly, and the same thing with fasciola. You'll see this because all these things and watercress are all grown in huge swampy bogs or lakes, and the sheep eat it. And that's how the cycle continues, okay? Or goats. Other questions. 35-year-old woman with a 6-month history of weight loss, fevers, worsening headaches, and weakness. No travel history. Mentioned that she has had numerous sexual partners. Vitals are within normal limits. CT head shows 4 lesions in both cerebral hemispheres and 1 in the cerebellum. HIV antibody positive. CD4 count is 13. What's the next best course of action? Lumbar puncture and best course of action. Best course of action. Lumbar puncture and send CSF crypto. B, treat with permethrin and sulfadiazine. C, send toxo antibody. D, order stool studies. E, begin heart. What? Like B as in boy or E as in Eric? Okay. You were masticating, so I don't know. Yes, why? What did Rybold say? She's so far away. But what is it? Right. Is A wrong? No. But You want to do that? You want to cause herniation? No. Treat first, and then we'll see what happens. Okay. Again, toxo, AB complexes, same thing. Related to Plasmodium, Cryptosporidium, we've been through that ad nauseum. Again, everybody becomes infected over their lifetime, even people who are vegetarians. Okay, affects all tissues, muscle, and CNS. Meow, like Charlotte's huge leopard that she has in her house, and other mammals. Okay, multiple CNS lesions. That's where you see it. Again, it can be anywhere. Muscle, skin, soft tissue, everywhere. Immunocompromised patients can happen. We had a case 2 years ago. Who had it here? I forgot. One of the second years. A young lady was who is in extremely good shape, non-HIV, non-immunocompromised, got full-blown, really bad toxoplasma infection because her boyfriend, now husband, made deer sausage. And she probably ate a cyst. And now she's on Cotrimox for life. She's 30. Again, so it's not just immunocompromised. So, think about immunocompetent patients as well, depending on the case. All right. Again, permethamine sulfadiazine, remember the whole pharma bro thing? He raised the price of sulfadiazine, remember that? And, like $700 a tab and stuff. Cotrimoxazole, again, is the prophy therapy. Could you treat with it? Yeah, but it's not ideal. All right. All right, here we go. Ready? 45-year-old man from rural Florida presents to the hospital with right lower quadrant abdominal pain, now with rectal prolapse. Complains of occasional bloody diarrhea and exertional dyspnea. No fever, labs, white blood cell count 8.3, no diff. Hemoglobin 9, Fe 58, TIBC 480, BUN 17, creatinine 0.8. This is question 14. Stool microscopy is shown. Yes. There are pictures. Okay. Which of the following can be said regarding this organism? A, it is associated with recreational exposure to fresh water. B, it enters its host by penetration of the skin. C, its pathogenesis includes oral ingestion of eggs. D, it is best treated with metronidazole. E, praziquantel is the drug of choice. Now we're getting into worms. So, what is this? And if you know what it is, what's the right answer? That's the point. Right, both like. So, what do you think it is? I know, but I'm not on the board with you guys. I'm not going to be sitting there saying, well, maybe. I want you to tell me the right answer based on what you think it is. Well, a lot of things can cause rectal prolapse, okay? But what is the right answer? That is correct. Why is this trichura? Not just the rectal prolapse. Look at the egg. Again, this is like, remember Sesame Street when we were kids? One of these things is not like the other. You have to think about this. There are a biaxial knobs on the eggs. Nothing else looks like that. Look at it. Nothing. Okay. This is what trichura looks like in your colon. They're little tiny little worms. The reason they cause rectal prolapse is because of the fact that the colon is really trying to get rid of it. And in doing so, telescopes itself. You have intussusception and other things. Okay? What do you above all people, who is tough as nails, is like not letting me look at the pictures? Yeah.
Well, nobody's eating coconut cake.
I will continue to. I love coconut. But, okay, I'm not going to go there. Whatever John wants to ruin desserts for us, that's fine. But notice here, again, so you ingest the eggs, that's true. Okay, larval hatch in the small intestine. In most of these, it was a paper a few years ago that actually looked at why did they hatch in the small intestine? And it actually has to do with interaction with E. coli. Once these things, some of these eggs start to touch certain gram negatives, or gram positives, but mainly gram negatives, they touch the pili, they start to hatch, so that they know where they're at. Okay. Again, this shows how intricate biology is, whether human biology, microbiology, or even nature, being out in the environment. That's huge. So then you start having lots of feces once male and female get together. You see, again, this biaxial knobs on there. They start to go in this 2-cell stage. They become a zygote. Then they start to go into metamorphosis, and they start to cleave. Once they get in there, you ingest the eggs. The cycle is complete. Okay. Question 15. 3-year-old boy, get ready, Yanina, presents to your clinic with evaluation. Mother states that he's had insomnia the past week, states he's had anal itching at night. He gives no other complaints at this time. Physical exam is normal. CBC white count is 6.4, hemoglobin 13.6 with a normal differential. That's normal for children. Which of the following is likely diagnosis? A, fecal smear viewed under the microscope. B, examination of stool for ova and parasites. C, adhesive cellophane tape to the perianal area. D, serum antibody testing. E, a carefully performed string test.
C.
What is this?
Pinworm.
Okay. What is the, as he would say, what is the Latin derivation of that? Enterobius. Okay. So this is a cycle, and that's why it cycles through children. Okay. Again, you ingest the eggs and it comes out. Why the anal itching? Why this picture that's all over Google? Why?
They come out at night.
So like the old 80s song, right? Freaks come out at night. Why do they come out at night?
Don't the female worms come out at night to lay their eggs?
Who is that?
Oh, hi, sorry, I'm a PA student at TGH.
High PA student at TGH. That is superb. And they actually love that cooler temperature. Okay. And that's why they live in the anal verge and they're kind of dormant. And then at night, when the temperature cools on the outside, that's when they come out and they start to reproduce. Okay. Superb. All right. Somebody always messes up this question. And this is a good question for you all because it is a 3-step process. 14-year-old girl originally from Malawi presents to the ED with complaints of right upper quadrant pain, nausea, and vomiting. Ultrasound of the abdomen is normal. ERCP is shown. Due to the complaints of light-colored stools, a stool for ova and parasites is sent, the bottom. The causative organism is also associated with which of the following? 1, cutaneous larva migrans. 2, Loeffler syndrome. 3, recurrent cellulitis. 4, hematochezia. This is one of the tougher questions in my series of questions, but I have complete faith in my pupils, and I think that you guys will know what this is. I like how Srinath is doing it.
Yes.
I hear nothing about the answer choices. Okay, Bowen wants to go with 2 or B. I don't know why I'm schizophrenic about the numbers. Sorry, letters are, but it really equates to B. Okay. Any other takes? It is Loeffler syndrome. What is this? Oh, geez. You just got lucky? Right, but it's really eosinophilic empyema. Now, okay, you got to the third point of the question with skipping A and B, right? 1 and 2 steps. What is this? For you to say, right? It doesn't mean that you're sure. Other ideas? Wow, that's says the man from South Africa.
It's a neighboring country.
It's not a neighboring country, but it's all over the place. Look at the egg. It's huge. It's huge and it's got knobs all over it. Look at the ERCP. There's something really big in there.
I thought it was Entamoeba histolytica, but I'm not sure about the Loeffler syndrome.
Well, obviously, but Entamoeba is not going to present with a worm on ERCP though, Fernando. So that's a problem.
I was thinking
And it
more
doesn't
liver
cause
after.
lophers. It doesn't cause lophers. What is this? Don't Google it. Just messing with you. Showing his gums here. What else? I'll give you a hint. It's the most common infection on the planet.
Strongyloides.
No. Ascaris, lumbricoides. 1 billion people are infected on the planet or more. Okay. This is the life cycle. Crazy. Okay. So eggs hatch. Okay. In the dirt. You ingest them. It starts this, they have these knobs. Look at that. It's an environmental organism. Those knobs are to protect it. You ingest it, and notice there's a little baby worm in there. You ingest it, it gets into the small intestine. Then you end up, goes to the lung. You cough it up. Some of these worms burrow through into the pleura, causing Loeffler syndrome. Then you swallow them. Then they get into the small intestine again because they're mature now. They start having eggs. And we'll have Yanina look away, but this is the most, look at all the distribution of this thing.
That's usually the picture that you're using.
No, there's actually another one where it's out of the anal verge and there's
Yeah.
like hundreds of worms coming out. Okay?
But they're.
I can't believe I'm shocking Yanina.
It looks like a grenade, right?
Yeah, it does.
Yeah.
And that's the point. I mean, not the Bruno Mars one, but it looks like a Bernay, like that, with knobs everywhere. It is most common in the central part of sub-Saharan Africa, okay? But it's all over the place. It goes as north as Mongolia, okay? And as south as Tierra del Fuego, all right? Now, again, one dose of albendazole and bendazole, these things all come out. And that's what you're seeing here, is giving, a worm treatment for just people and just doing, mass treatment for it, getting rid of it. The main problem with it is that it can cause all kinds of intestinal volvulus, intussusception, all kinds of problems, and a real issue. Okay. Now, yes.
And does it always cause that severe disease, or could it like sit dormant? Like,
It can sit dormant, but for the most part, they want to reproduce. How big are they? Okay, I like that. That's what my son says. They're big, Dad. No. I want a little bit more of an, superlative on the adjectives, ladies and gentlemen. They can be up to a meter. So they can be really big, as opposed to Trichuris, which is this big, pinworms, which are this big, and some are microscopic. Okay, 43-year-old, but they don't cause things like, anemia and stuff like that, like you would see with a lot of other worms, because they don't really penetrate the mucosa. 73-year-old woman from Southern Alabama, sorry to my Alabamians, presents with history of liver transplantation and cirrhosis 5 years ago. Is admitted with fevers, chills, severe headache. She's on glucocorticoids, mycophenolate. White blood cell count has dropped from 7 to 1.8 with no eosinophilia. Lumbar puncture demonstrates a meningitis with the Enterococcus. Ampicillin is initiated. What is the next best step in the management of this patient? 1, check serology for strongy. 2, colonoscopy. 3, treat with a course of metro. 4, begin melosoprolol. Why? The reason the original question had Klebsiella, I changed it because it can be Enterococcus. It's any enteric. It could be Bacteroides, right? Fragilis, even though it's hard to grow in the CSF because of the oxygen concentration. But still, you can see it. Again, why does this happen? Hyperinfection syndrome, I get it. But why? Why is this correlation always with some type of enteric? That's part of it. It's more likely the latter, okay? Because then it's coated in it, right? Again, these things, once they get in the intestine, there is this symbiosis or mutualism to where they see the worm or the worm sees the E. coli, whatever, and then they start to reproduce and they start to do things. Okay, crazy. You can look at this on your own time, all right? Basically, it's the same. Again, it's this, this life cycle is nuts where you have auto-infection. It can actually, you can not only infect yourself, but infect people close by to you. It's really nuts. But just know this, that again, there's different ways that it can get in, but it does the same thing that Ascaris does, is that it gets into the stomach, you cough it up, gets in the lung, you regurgitate it up again, and then from there it gets into the bloodstream through the lung or through the intestine. Right? This is the hyperinfection syndrome. You can actually see the worm in there histologically in the skeletal muscle. Okay, and this is a patient obviously with hyperinfection syndrome. Okay, Fernando, you are excluded from this. So, who is Bailey Ashford? It's not on your boards, but it's important for the next point about what we're going to learn. Oh, and you're excluded. No. He was American. All right. Okay, well.
Big picture thinking, that's big picture.
I think the cast of Hamilton would disagree with you. So he was actually a colonel in the U.S. Army, and he was stationed. He was part of the Rough Riders, but he's not what he's known for. He was stationed in Puerto Rico as one of the main medical officers there during the period after the Spanish-American War, all the way till he died in 1934 rather. And so he noticed that there was a lot of anemia in the population, specifically in kids. And he started noticing, he was like, this is crazy. And so he found something, and he's told them, do one thing, and we'll get rid of the anemia. Shyla, what was it? Shyla's Instagramming.
No, I'm not Instagram.
It's he gave the kids shoes. Say that louder? Look at that, Bowen on point.
There you go.
And he eliminated hookworm infection from the Commonwealth of Puerto Rico. Really simple, by giving shoes. Why? So hookworms, again, penetrate the skin. Okay? Not unlike very different from the rest of them that we've seen in the lecture so far, which are fecal oral. Okay? So gets into the skin, penetrates, and again, gets into the bloodstream, goes into the lung, then gets in the intestine. You cough it up, goes in the intestines. Now, they cause anemia. So what do? Yeah, they're after iron, right? Same thing. And that's why they have these nice mouth parts. Okay, see it? And so, again, I'm trying to shock you, Nina, with every photograph. So I just don't understand. Anyway, so there's Necator americanus and Ancylostoma duodenale. How do you know the difference? Which one is in which part of the world? Yeah, Necator is in the Western Hemisphere. Ancylostoma is in the Eastern Hemisphere. Okay, they have mouth parts. What are the mouth parts for? Not only to grab onto the villi, but to penetrate them to access the blood. Okay, notice Necator has more of a shaved appearance to its teeth as opposed to Ancylostoma. Okay, Toxocara is in the same family. Okay, they go through. They're supposed to go through lagomorphs or large rodents. What is a lagomorph? Rabbit. Okay. Bugs Bunny, a hare. Okay, things like that. And so, they're not rodents. They're a slightly different family. And so, they're, they are eaten by canids, dogs, wolves, oxen, things like that. And then the cycle will continue. Now, once it gets into you, it likes to go to the CNS. It can cause the cutaneous larva migrans. but will go to the eye, and you will see this infection. Okay, but most of the time you'll see it. The people will actually say that they're feeling like itchy on their skin, really on the chest. Nathostomia, we'll look at that later, also does the same kind of thing, but it's a totally different vector. Okay. Now, Babesiosis ascaris. This is why we tell people cover your sandboxes or don't let your kids play in sandboxes. Okay. So same life cycle. It could be rover up there, but for the most part, it's raccoons. All right. What happens? So the raccoon eats a lagomorph and also eats their brain, and that's where the worm is. Worm gets inside the raccoon, and then the raccoon's eggs will go to dirt, and then from there the child will consume the dirt. The worms will eat the brain, and then basically the child is brain dead. Okay. This is why we tell people cover your sandboxes and don't let your kids play in sand. Okay. But it's the same kind of thing. And this is the evidence inside of a muscle tissue there with the worm in its pieces. Okay. Drununculus metanensis is a guinea worm. This is what former President Carter tried to eliminate. And so it's a very crazy life cycle. So it actually cycles through 2 or 3 different types of animals, right? So dogs will poop in the water. In there, the eggs hatch, will become copepods. Yeah, this is how you have to learn some biology, people. And then they'll find the worms will find a copepod. Those are consumed by either amphibians or fish. Those are then consumed by some kind of canid, and then from there it'll cycle through, right? Now, when you drink water or consume fish or amphibians, okay, that are not cooked, then you get it. And it likes to go to the skin and come out to breathe. So how do you get rid of it besides making sure people don't do these things? Is you actually have a little stick. People have been doing this for centuries in sub-Saharan Africa, for eons actually, and you kind of roll the worm out. That's what you do. Okay.
There's like a treatment protocol program back in.
Yeah, that's what Carter tried to do, and now it's trying to come back because some governments are like, well, and there's definitely no funding for it, so forget it. But that's part of the that's what this is. Okay. All right, back to questions. And this is not tricky Cannella, it's trick Cannella. Which of the following is true? I know you're the only one laughing now. 1, the incidence in the U.S. is low due to the diet of swine. 2, acid pepsin digestion in the stomach can release larvae and contain in the cyst ingested with the contaminated meat. Thiabendazole is the treatment of choice. Cooking meat above 55 degrees centigrade until pink flesh is browned kills encysted larvae. 5, all the above. That is correct. Why? So what are we talking about? Trichinella, right? So, we watch what pigs eat, even though they eat slop. We really do in the U.S. Consuming feral swine is a real problem with this. Yes, the acid in the stomach digests the outside of the cyst. That's how it's released. Thiabendazole is a treatment choice, and you're supposed to cook the meat until really brown. Problem is with pork, if you do that, what happens? It becomes very dry and terrible. And so even smoking the meat doesn't kill it. Okay, so it's called Trichinella spiralis for a reason. It likes to make this beautiful cochleal-like shape. Okay, snail-like shape. So what's the life cycle? Really goes through rodents. Okay. Yes, pigs are omnivorous. They can eat everything, okay, including rodents. And so the domestic life cycle goes between rodents and swine. The sylvatic, what does sylvatic mean? Wild. Sylvatic means wild. So wild animals, whether they be feral hogs or bear, will consume the rodents. Then they'll poop it out. And the cycle continues. And again, it gets inside of muscle and can be a really, really big deal. This is why hunting bear meat is a problem. Okay. Mm-hmm. Right. They killed a brown bear, and they brought it back with them. It wasn't a black bear; it was a brown bear that they killed and brought the meat back. Ribald's like, this is why I don't eat that. But it's the truth. Okay.
The brown bear, or no?
Yeah.
Okay.
Well, grizzly is a type of brown bear.
Okay.
Because it's has more of a grizzled or gray appearance on the end of their fur. And then of course polar bear, which is a delicacy in the Arctic because there's not a lot of animals, right? But it does go through rodents, and lemmings are part of that cycle, which lemmings reproduce like crazy, and that's actually the main food source for a lot of animals in the Arctic. So Capillaria, philippensis, and hepatica, it's almost identical to Trichinella, except for you get it totally differently. You get it through consuming fish, raw fish. Okay. The cycle goes through seabirds, mainly pelicans. Okay. But when you consume it, it can get inside soft tissues and muscle. It can even go to the liver and cause liver damage. And that's why there's a problem. So where are you going to see this? Mainly on the western part of the Ring of Fire. So in western part of the Pacific Ocean. Okay. All those archipelagos. Question 19. 45-year-old man from Mexico presents with a seizure. HIV negative. CT of the head is shown. Consuming undercooked pork can predispose you to this disease, true or false? Rybold is shaking her head, not nodding. And Celia is like, I really don't want to be.
You get it from a different way. You don't get it from the pork. You get it from the feces.
Fecal oral.
There we go. They usually
Form that up
defecating. They're defecating on the plants that you eat.
Or
So like if you get like veggies.
Yeah. Yeah.
right. Now, can you get it through autoinfection? Sure. But by then you really have antibodies to it, and it's a kind of a problem. So you don't really do it. Why do we know this? Well, let's talk about Tinea solium and Saginatum. Okay, so what is the difference? Beef. Does it infect? It can infect you, but does it cause cysticercosis? No. Is it always go to the brain? No. It can go to muscle, bone, all kinds of places. Okay, and you can tell by looking at the uterine sections here between the two. Solium, they're much thicker in the proglottids. Saginatum, they're much thinner. Also, if you notice, solium has these little hair-like hooks at the edge of the head. Okay, Saginatum does not have that. Now, here's the life cycle. Okay.
Excuse me. I'm really sorry. Could I just ask really quick, why was it false that it predisposes you to the disease if you eat pork?
So what it is that you can get it, but the main way that you get it is through eggs.
Okay.
Okay. Consumption of the eggs from the worm of somebody who is infected. You can get autoinfection, but again, most people have antibodies and will prevent you from getting the infection again. Okay, you have IgA that starts to bind the organism once it comes in before it hatches, and your body gets rid of it. It can happen, but it's not common. The most common way to get the cysticercosis part is from consuming the eggs of somebody who is infected. Okay, this is the life cycle. It is only in swine. Okay. Now, why do we know this? So this is a study in the New England Journal of Medicine from 1977, the year I was born. And this study looked at a family of Orthodox Jews in New York City. They all got neurocysticercosis. All of them. But you're like, that doesn't make sense, Anthony, right? Because Orthodox Jews do not eat pork. No, but their housekeeper from Guatemala did. That's how they got the infection. She was not washing her hands the right way. Who else are we seeing with this? This is happening throughout the Middle East and into parts of South Asia, where consuming pork is against religious, mandate. There are parts of southern India that do consume pork, mainly in Mysore, but the rest of the subcontinent doesn't consume pork, especially in the Muslim areas, right? And so, but people from other parts of the world go there to work, and what happens is that they're infecting those people. There was a huge case report out of Oman, okay, that I don't know how many people in a family got infected because their housekeeper and their cook were both from Nepal. Where there, they do consume pork. Okay? Again, pigs are easy to grow. They get really fat, and it's easy to cook, and you can feed a lot of people. It's cheap. Other things are not, and that's why this is a problem. Okay, so they could ask you a question where they will have either a religious inference or a geographic inference on the question stem for cysticercosis, and it doesn't have to be the brain. Is that clear? Now this is one of the tougher questions in the series. What? Because
Asterisk.
yeah, it's not a Michelin rating. It's because it's one of the harder questions. I want to make sure everybody thinks about this before answering with some dumb answer. Question 20, which of the following is false regarding hydatid cysts? 1, Echinococcus granularis, false. I did this on purpose to make you think. Echinococcus granulosus or E. multilocularius are the causative organisms. 2, symptoms develop early in the course of infection, with abdominal pain and diarrhea being most common. Surgical resection in the treatment of choice, and the cyst should be removed intact. 4, aspiration with installation of hypertonic saline is helpful in reducing the risk of infection intra-op. 5, albendazole is also recommended perioperative. 2. Wow, very aggressive. I like this.
It's as aggressive as a 3-star.
Well, it's necessary. Any other thoughts? Correct. So let's talk about this. So Echinococcus is the dog tapeworm. Okay. It cycles through canids and their kin, foxen, things like that, right? Not mustelids like, weasels and wolverine. No, it's really through the canid family. So what happens? They poop out eggs. They're consumed by some type of, ovid, whether it's sheep, goat, something, could be antelope. And then the animal dies of the infection or is killed by the canids. And then they consume everything, including the organs. They're not really, right? They're not really selective, having lamb chops. And so they eat everything. And when they do, it gets into their system, gets into their muscle and gets into their intestine. And then from there, they start to poop out eggs. Now, they like to go in people and also in the other vectors into the organs, mainly liver. Can it go to the lung? Sure, but it likes the liver and also the intestines. Now, multilocularis is a little different. Okay, the same eggs go through foxen, okay, or smaller canids like coyotes. Okay, then from there it'll be consumed by rodents, maybe lagomorphs, but really rodents. From there, they're eaten, okay, but it likes to go to their lung more than the liver. Okay, and in people, the same thing. And then the cycle continues once the rodent is consumed whole sometimes. Now, let's go back to the question. Okay, so we know that granulosis and multilocularis are the main organism. Okay, it's all over the world, but we mainly see cases from the old Eastern Bloc, okay, in the Slavic countries of Europe. Okay, that's where we mainly see cases. Last case I saw was somebody from Belarus when I was at UC San Diego. Okay, and we couldn't get rid of it. It kept coming back. All right. Symptoms are really later in the course. Okay, yeah, you can have some abdominal pain, but really it's pretty asymptomatic until things blow up, mainly in the liver. Okay, surgical resection is hard to do. Okay, there's specific places in the country like Albert Einstein University and Cornell. They have a good program to do this because they see a lot of cases mainly again from Eastern Europe. Okay, and what happens? You actually have to you pierce the cyst carefully. You give them steroids. You also give them albendazole. You inject the cyst with hypertonic saline, and then you aspirate it really quickly. Because if it gets in the belly, what happens? Yes, bad. Really bad. Okay? And so this is part of it, and it is a unique thing. There was a whole thing on ID Week several years ago by Dr. Sears from New York at Albert Einstein, and she went through this. It was amazing how they do it, and she actually showed a video. All right. Yes. Oh, he has a lot of cool stuff, but a lot of it's crap. All right.
But specific.
So like the guy had like what they call epidemic, the sector that had no idea it was Trypanosomiasis, and then the path came back and showed the actual like
Larva.
yeah, you can see the little like the cross section of the
Awesome.
and so then Jay ended up getting referred to VA. The way he got it, he was a vet. He spent over a year in Afghanistan, spent time with the locals and all that. He only had lung involvement, didn't have any liver.
No, more than likely, it was probably consuming of something. It was probably multilocularis. Could it be granulosis? Sure. Because what is the main protein that's consumed in those areas? It's usually mutton, right? Or goat, right? And so, and if you consume the organ meat, that's where it is. It's not in the skeletal muscle at all.
The one that
It's everywhere. But you can see it in the New World.
specific history in that area.
Interesting. I mean, I know that
I don't know if it's important.
Brucella is very common in certain areas because of the queso fresco review of systems, as I call it, consuming that, right? But there's other things that it could be. Again, I don't know that per se, so I'm not going to comment. Okay, question 21. 43-year-old man from Western Africa presents with intense conjunctivitis. Eye exam is shown. Which of the following is the causative organism and treatment? Now we're getting into the filaria. Diofilariasis, pulsated laser therapy. 2, Onchocerca volvulus, ivermectin. 3, Loa Loa, ivermectin and DEC or DEC. 4, Paragonimus westermanni, which is albendazole. 5, Brugia melee, thiabendazole. Okay. That is correct. We actually had a case here 2 years ago. The ID fellow didn't think it was that interesting. Shocking. And it was the ophthalmologist who made the diagnosis, who found the worm, called me because I was on his PhD committee at UF. And then he said, Anthony, what are we going to do? I said, get a Giemsa stain in the blood. We found it in the blood. He published it. Super duper cool. And later on, the fellow was like, oh, I want to publish it. Well, you got scooped. You didn't want to be part of it. There you go. This is why if you're going to do academics, you got to be aggressive. You got to talk to people. And yes, this was cool as hell. 65-year-old, question 22. 65-year-old man presents to you at the VASPA with history of large legs, which gotten worse for the past 10 years. Vietnam vet, 2 tours. Past medical history, smoker. Okay, he's got CAD, treated for malaria while in Vietnam. Okay, what most likely happened to this patient based on his history? A, lymphedema due to tobacco use and poor diet. B, Aurentia infections persisted since his tour in Vietnam. C, treatment of his malaria, yet filarial nematodes were not treated. D, all the above. C, B, D. What was Sesame Street? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. I'm too old for this. What? Yes. Okay. Do we really think it's A? No. Throw it out. Is D? No. If A is wrong, can't be D. What about B? Aurentia? Shushuagami? So it is. So hold on. It's actually, what is Aurentia? Woo, typhus. Ribald, home run. Right, and it's mainly in again in East Asia and all the way through to South Asia. And what is the vector? Come on. No. Another crustacean. Yes, it is a chigger. And they bite. It's really painful and it causes an eschar. It's black. When you get bitten by a louse or you get bitten by a flea, it's not. And those are the other rickettsia that can cause different types of typhus. Okay. More than likely, they probably gave this guy mefloquine, didn't treat it, right? And didn't treat the filaria. All right. Things are getting hotter. filariasis can be caused by each of the following, except, I know we're not doing except, but I'm doing this on purpose. 1, Wucheria bancrofti. 2, Brugia malae. 3, Brugia timori. 4, Diphyllobothrium latum. Okay, good. Okay. Notice all the places that Reibold is going to. Okay, I've got filaria. Malay, of course, for the Malay Peninsula. Timor from the Timor Islands, right? So these things are named after places. It's good to know geography. Very important, right? Which of the following is effective treatment for filariasis? 1, DEC. 2, ivermectin plus albendazole. 3, anti-inflammatory agents, compression stockings, and anti-parasitic agents. 4, doxy. 5, all of that. Bowen's like, dude, is it Friday yet? No, what? Why is it all the above?
3 makes sense. And then it has to be one of the others.
It has to be at least, I
That's
remember,
Form.
I remember the yes, and then.
They all sound good.
Now-
They all sound good.
Besides, because Srinath, I didn't teach him this, I don't think, but everybody else has been through ASP. Well, you guys know. But I want to know why doxy is correct. Reibold, again, batting 1,000. So, what is Wolbachia? Yeah. So, Wolbachia is a gram-negative small coccobacillus. It's part of their intestinal flora. They can't survive without it. This is why giving somebody a tetracycline for malaria prophy also prevents this. And this is why this is a good thing. Yeah. Is it good to give doxycycline to somebody who's going into the tropics? Probably not. But you have this, there's a benefit to this, and it's because it kills Wolbachia. Okay. All right, let's talk about the filaria. Okay. There's lymphatic filaria and ones that also attack other parts of the body. Okay. So you have the lymphatic ones, which is Wucheria bancrofti, Brugia malae, Brugia timori, right? And the main vector are mosquitoes, Anopheles, Aedes, and Culex. Anopheles is where really Plasmodium comes into play, but they all can transmit the filaria. Loa loa is transmitted by Chrysiops, which is the deer fly or mangrove fly. Okay, and again, where do we see this? Mainly in the southern part of Western Africa. Okay, all the way through to the Congo River. Onchocerciasis, same place. River blindness. Onchocerca volvulus. Simulium is the black river fly. Okay, and how do you diagnose it? Mainly with nocturnal phlebotomy. That's cool. So you do it at night because that's when the bugs bite you, right? And you're stationary. That's cool, right? Really cool. In fact, the use of ivermectin was first done in 1981 on somebody who had river blindness. Because before it was only used for dogs. And this guy took it and he cured himself. And then they started to study it. Really cool stuff, right? Okay. All right, so here's the life cycle. Again, whether it's a mosquito, whether it's a fly, they get into the lymphatics and then they go to other places, okay? Especially for whether it's Wucheria, Brugia, or the Loa loa, okay? It doesn't have to be the eye, it could be other places. Onchocerca, a little bit different. It too does go to lymphatics, but really likes to be in the subcutaneous tissue and also then go to the eyes and start to chomp on the optic chiasm. Okay? And again, Simulium is the vector. All right, let's talk about the treatment. Here's where the pharmacy people are like, oh, great. So for lymphatic filariasis, you use, albendazole and DEC, okay? And then, or plus or minus doxy for the Wolbachia, okay? Onchocerca, it's ivermectin plus doxycycline, but there's a new drug that came out in 2018 called moxidectin, okay? And that we do have in the United States, but it's hard to get. But again, why not use ivermectin? Especially in some states now, it's going to be over the counter. All right. So what do these drugs do? That's the thing. Everybody's like, yeah, just give them this. So what does DEC do? It inhibits arachidonic acid. Okay. So the organism can't make certain proteins. Okay. And get certain processes done. Ivermectin inhibits glutamic acid chloride channels, And again, you have paralysis of the worm. Okay, that's what that is. Praziquantel inhibits calcium channel ion channels. Okay, and again, paralysis of the worm. Albendazole inhibits microtubule formation, and again, paralysis of the worm. This way, you can just poop it out, or your body can destroy it. Question 25. We'll get 5 more questions, and we're done. Which of the following nematodes are correctly matched with intermediate hosts? 1. Clonorchis sinensis, snail to fish. 2. Paragonimus westermani, crustaceans to a mammalian carnivore. 3. Fasciola hepatica, snails to ruminants through watercress. 4. Schistosoma, snails to humans. 5. All of the above. That is correct. All right, case 4. This is an actual case that I saw. This is the country of Malawi. 26-year-old woman from San Diego presents to the ID clinic after being referred to Hem-Onc for a blood test for an AEC of 2,000. Patient reports having abdominal discomfort since returning to U.S. from Malawi 4 to 6 months ago. Pain worsens with meals and experiencing nausea and 5-kilogram weight loss over the last few months. She denies any hematuria or cloudy urine. Past medical history, none. No family history of hypertension, cancers, or rheum. No allergies, no meds. She's born in San Diego. Teacher, worked in Malawi for the past 3 years as an English teacher. Outdoor activities, she traveled to Lake Malawi once, only 3 months prior to return to the U.S. No sexual intercourse while she was there. Vitals, 97.6, heart rate 83, blood pressure 115/69. She's thin, Latina woman in no acute distress. Her OP is clear, no icterus, no JVD, no LAD. The rest of her exam is okay. She does have some tender depopulation in the right lower quadrant. And also she does have hepatomegaly because that's where the liver edge is. It goes all the way to the right lower quadrant. Okay, CMP within normal limits. CBC, except for EAEC of 1150 by this time. Urine, eggs are noted. Schistosoma antibody, positive. Which of the following is associated with hematuria, bladder obstruction, and hydronephrosis? S. hematobium, S. japonicum, S. mansoni, S. mccongi, B. melee. Rouge melee. Are we sure?
Yes.
It is. So let's talk about Schistosoma hematobium. Okay, this is the male worm with the female worm tucked inside. And they make thousands of eggs a day. Okay, so it's,
Internal copulation. That's my prior problem.
I'm going to leave that alone because I am a senior faculty member. I'm not getting in trouble on this call. And also known as bilariasis, okay, after Theodor Bilharz, German physician who actually identified the worm. Okay. 1 in 30 people has it. It's not as common as Ascaris, which is like 1 in 5, but still. Most endemic infections occur during childhood. Okay. So it goes through snails. Okay. And I actually have a picture at the end where you actually can see the cercaria coming out of a snail into the water. Once you dip your finger into the water, they like skyrocket. It's really cool. Okay. Notice, look at the worm's eggs. Mansoni, okay, has more of a lateral spine. Japonicum doesn't have a spine. Hematobium has an axial spine. Nothing else looks like this. You can tell which is which. Okay, so Schistosoma mansoni and is mainly found in South America, Caribbean, Africa, and Middle East. Let's get back to how do I get back? Where? Yes, and Laos, right? All that area. Okay, so those sans hematobium go through the liver. They go to the portal system. Hematobium goes to the venous plexus of the bladder, right? So let's talk about this. So they're really asymptomatic for the most part, the acute features. All right, let me minimize this. So Katayama fever is what is a hypersensitivity reaction, all right? It happens 2 to 8 weeks afterwards. And again, because everything is all over the place. There's tons of eggs around. It's very immune stimulating and it really pisses off the body. What is swimmer's itch? Did you just scratch yourself? Gee. To what? Wait a minute. Everybody clap for Dr. Shaw. All right. What is swimmer's itch? So this was actually on one of my boards, on my ID board. Swimmer's itch is caused by avian schistosomes in large lakes, mainly in temperate areas, mainly the Great Lakes. So it'll be a question of somebody in July is swimming in Lake Michigan, comes out and is starting to scratch and itch really bad. That's because bird schistosomes are trying to get inside you, but you're not a bird.
The question that's in your board review is like these people that were in a summer camp and they went into the lake, and then next year they went to the same camp and swam in the lake, and then had these symptoms.
All right. So again, let's look at the eggs. We talked about this. You could see eosinophilia, who knows? But there's all kinds of other dyscrasias, blood dyscrasias that occur. Okay. Again, there's 3,000 eggs per day can be formed. Look at the images of the eggs again, please. So Japonicum and McCongie look identical. They're round. Okay. Mansoni looks like that with the lateral spine. Hematobium, again, with the axial spine. The way that I've always been taught, and I think John taught me this 1,000 years ago, is with the lateral spine, again, that looks like the portal system coming into the liver, and then going down looks like the bladder and the urethra. Okay. Yeah.
Like the circle.
Yeah. Right. Now again, no, I was identified in Japan.
Yeah.
But I think that but the problem is that McCongie cannot be associated with a flag.
No.
And so that's why you have to think about, know the names of the organism. Mekong River in the southeastern Asia. Okay. So the immune response, I'll touch on this briefly because I'm an immunologist. Again, Cercaria skin penetration is usually a Th1 response. And adult worms are being attacked. And then the response to the eggs is mainly a Th2 response. That's why you have this crazy eosinophil count that skyrockets, T cells go down, and whatnot. Okay, I'm not going to go through that. The serology, everybody in the infected area has it, so you can't really use it to diagnose. But it is nice to see if somebody says, like the editor-in-chief of CID told me that Lake Malawi was just a stone free, but it's not. So how do you treat it? Praziquantel, again, we talked about how the drug works. And it also damages the integument of the trematode with increased antigen exposure to the surface, and you use it 1 to 2 doses, usually about 7 days apart. And then you have 6-week follow-up, and you have to use glucocorticoids for CNS schistosomiasis, which happens. Okay, and it can mimic neurocysticercosis or Kadiyama fever. All right. Question 27. We're almost done. Thank you. 25-year-old woman from Norway is in the U.S. for a semester abroad. Presents to your clinic with symptoms of diarrhea, abdominal pain, fatigue, and weight loss. On physical exam, she has somewhat pale conjunctiva. Close the door, please. On laboratories, white blood cell count 6, hemoglobin 9, platelets 201, MCV is 101. Notice the first time I've said it. You ask her if she imbibes ethanol, to which she says rarely. You check her folate and cyanocobalamin level. Folate level is normal. So cyanocobalamin level is less than 100 nanograms per milliliter. What's cyanocobalamin? Vitamin B12. Which of the following is causing her megaloblastic anemia? A, schistosomiasis. B, diphyllobothrium latum. Babesiosis Ascaris procinus, or Fasciolopsis burksii.
B.
Correct.
We've been clueless most of this thing. Don't worry.
Next year I'll have Dr. Shaw do the question. So it really goes through cold water fish, mackerel, herring, things like that, right? Anchovy, but really larger fish like the again, herring and mackerel, okay? And so again, it cycles through copepods, and then from there you consume the fish after it's consumed something small like sardines or anchovy, okay? And whatnot. And again, these, it causes a decrease in cyanocobalamin, and once you've had it for a long time, and pickling doesn't kill the worm, okay? All right, here we go. So raw fish infection, this is a problem. This is why Yanina only consumes meat. Is Clonorchus, again, you can have jaundice of the eyes and skin, okay? Enlargement of the liver and tenderness of palpation on exam. Gastrointestinal nausea, diarrhea, vomiting, abdominal pain, loss, and anorexia, okay? Anisakis is usually sudden severe pain, okay? Diphyllobothrium, central irritability because of the loss of B12, skin problems because of the loss of B12, heart, increased heart rate, muscular weakness, and vague abdominal discomfort. All right, a couple of other questions. We're going to gross out Yanina a few more times and we're done. 19-year-old man from central Missouri presented to the hospital with hemoptysis, weight loss, mild fevers. States that he started having a cough as the initial symptom about 3 to 4 weeks ago. He was treated with several courses of oral antibiotics to no avail. His chest x-ray showed a small cavitary lesion in his right upper lobe, small right-sided pleural effusion, and he had evaluation for pulmonary tuberculosis and was found not to have the disease. Avid freshwater fisherman, enjoys drinking with his friends and even engaging in noodling. I don't know why Srinath is laughing, but noodling. On physical exam, overweight man displaying symptoms of tachypnea. On laboratories, his white count is 9.7. Absolute eosinophil count is is 1,280. Hemoglobin is 14.1. After thinking about the case, you give him a dose of Prosi. Why? Which of the following scenarios of this patient would lead you to his diagnosis? A, traveled to Alabama as a child and walked barefoot outside his grandmom's house. B, traveled to Ukraine and engaged in catfishing there. C, became inebriated after fishing and consumed raw crawfish on a dare. D, he flew to Brazil where he swam in the Amazon and went anaconda hunting, kind of like Ribble. What is the right answer? C. Correct.
Have you been noodling?
No, but I know what it is because I've seen people do it. Actually, mainly in the Ozarks.
Can we explain to
So,
everyone what noodling is?
We're going to get there.
Okay.
We will get there. It's not making pasta. So what happens is that and it's usually seen in East Asia, but we can see it actually in North America in freshwater crustaceans. And this is consuming raw freshwater crustaceans, crabs, shrimp, crawfish, crawdaddies, mud bugs, whatever you all call them. Okay, but usually cycles through small snails. Okay. And then the copepods, again, they kind of go into there, or they're ingested actually by the crustaceans. Okay. And then you poop out the unembryonated eggs, and the cycle continues. So we didn't know about this till the 90s because people didn't know what it was. This is a guy with a raw crayfish in his mouth. Okay. And so again, what is noodling? Everybody's going hand, arm. So catfish that's why I mentioned catfish in the Ukraine, but not here. And so again, I doubt if somebody from Missouri is going to just go to Ukraine to do catfish hunting. But anyway, what happens is that freshwater catfish get huge. 100, 200, 300 pounds is not unusual. And they burrow in these huge holes inside of riverbeds, 5 to 6 feet down to copulate, okay, and make eggs and reproduce. There's 2 of them in there, male and female. So what happens is that people get really drunk, and there's also competition for this, where you go in, head down, bare hands, grab the catfish, pull it up to show how big it is. Gotta love the masculine toxicity. Anyway, the problem is that when people do this, they get really drunk, and they consume raw things, especially crayfish. And so this is a picture, and this is a paper from, I think, 2007, where we started to notice all the way back from the 90s, people having a tuberculosis-like illness, but it was really a worm, and it's Paragonimus. Okay, all right.
Crazy people.
People lose fingers.
I don't know.
I have friends that did it back in Maryland.
So Americans, basically.
Yeah.
Markets.
Yeah.
People lose hands and fingers.
That's true, right?
Again, I'm a senior. I'm not going to go there. All right. All right. 2 more questions and we're done because Dave keeps looking at his watch. Question 29. 38-year-old marketing executive presented to the ER obtunded. Oh, I'm sorry. Well, who knows?
4 minutes per question.
Then we'll have a, BMT whatever in here. Anyway, 38-year-old marketing executive presents to the ER obtunded with mild fever. Her fiance states that her current presentation started over a week ago, at first having a headache and a mild stiff neck. Reports that she started having visual disturbances and had some limb tingling and myalgias 2 days before presentation. On exam, she's obtunded. Mild fever, 38 degrees, and has some diminished deep tendon reflexes. On laboratories, white count is 12,000. Absolute eosinophil count is almost 2,700. CSF laboratories with a white count of 161, 120 of those are eosinophils. They recently returned from Thailand, and approximately 1 month ago, they were stayed at the resort in Phuket and 2 days in Bangkok. Laboratories, again, white cell count 12,000, absolute eosinophil count 2,700. We talked about the eosinophilia in the CSF. Gram stain negative, HIV negative, you initiate antibodies, glucocorticoids, and mebendazole. How could she have prevented obtaining this infection? Refraining from consuming raw fish. Refraining from walking barefoot in Phuket. Refraining from feeding the macaques in the city of Bangkok. Refraining from eating raw leafy vegetables in a salad she ate at the resort. At the moment, I like that. Would you like some tea? The moment. Okay, what do you think it is? Fasciola? Really? In the brain?
Yeah, it's typically
Or into the cup.
Eosinophilic meningitis. What are we thinking?
It is D. It's Angiostrongylos, the rat lungworm.
I had a patient that had, or group was that basically. He drank snake blood while he went to Thailand.
Yeah, interesting.
And, well, it was a patient. It was a friend. No.
Okay.
Snake blood that
interesting choice of friends.
to like one of the shops.
So you do that and Yanina's friends drink vodka. I mean, it's very simple here. All right, so the rat lungworm. CNS risk is huge, eosinophilic meningitis. Incubation period is around 3 days to a little bit over a month. Western Rim, Hawaii. And southeastern Florida. Yeah. So how do you get it? So rodents eat everything and anything. And one of the things they like to do are eat mollusks, right? Slugs, snails, and stuff like that. The slugs and snails like to eat vegetables. Okay. So what happens is that you go to a resort and you're like, ooh, raw leafy vegetables. Notice in all these places, you've never seen people consume raw leafy vegetables, but they serve it to you. Okay. So what happens? The mollusk, the snail or the slug is in the leaves. And what do? Chop, 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 chop. And the snail meat is in there. You're consuming it with the worm. You are not a rat. And so it's going to kill you. And so this is the main problem. This is why you have to be very careful what you eat and where you go and what you do. And why in travel clinic, it's really important that you not just say, here's malaria prophylaxis, spray a little bit and go bye-bye. Okay. But you have to be very elaborate in what you describe to your patients in these clinics. And this is it might not happen all the time, but when it happens, it can kill you. So again, glucocorticoids, thiobendazole, bendazole, ivermectin, it might be a use for it. We don't know. High mortality if you don't treat it. Okay. Very few things give you an AEC that high outside of Job's, Doc8 deficiency, Coxy maybe, but also eosinophilic predominance in the CSF. Last question. And this is an actual case that I had. 27-year-old man from San Diego presents to you with severe abdominal pain and vomiting. Reports no travel or medications. He's not a hunter and he works in computer software. Upon further questioning, he reports attempting to make his own locks with fresh caught salmon from his friend gave him from British Columbia. He has no eosinophilia or other laboratory abnormalities. What is the cause of it? Diphyllobathrium, Anisakis, Paragonimus, Nathostomia. B and C? No, but he said B and C. Okay, so we got Ribbolt. If you're going to bet the money, Ribbolt's probably right, right? Maybe. But what else? What is she right? Dr. Nazef is looking at me like I'm an idiot. Well, that could be true too.
Yeah. I like your candor.
Yeah. It is Anisakis. So Anisakis is a worm that goes through large fish, salmon, mackerel, king mackerel, also known as kingfish, okay, and other fish like that. And then they're consumed by pinnipeds. What's a pinniped? Seals and porpoise, which includes killer whale and dolphin. Cycle continues through them. You are neither. That's why you have to be very careful when you eat raw fish or you make your own lox. So what happens is that in Japan, they actually have, when you're a sushi chef, it takes years, decades to master the technique of pulling out the Anisakis worm and cutting it out. Decades. If you watch Jiro streams of sushi, you'll understand. Okay, he's 99 years old, has a Michelin star restaurant in a mall in Japan. Okay, really cool story with his son who's still an apprentice at 70. And they have to scoop out the worm a certain way. You can freeze it, but it has to be deep freezed, like minus 40, and then plus 140, 145 to cook it. You're making lox and you're putting salt and sugar on it to put on your bagel and schmear. It doesn't work. You don't cut it out. Fair? So the worm thinks that you are a pinniped or a dolphin. Can't get out. So it causes intense pain, mainly right lower quadrant. Okay, you think you have appendicitis. You don't. You have a worm because you ate bad sushi, right? From Tokyo Shop on Dale Mabry. And that's a problem. That's why you have to know where you're going and what people are doing. Okay. So let's talk about the Helminth breakdown before we get kicked out of here by BMT case managers. Cestodes, Chynococcus, granulosus, and Motilicularis. Taenia, Solium saginata, know the difference. Diphyllobothrium, those are cestodes. Those are segmented worms. Trematodes, flatworms, okay? Schistosoma, we've already gone through those, okay? Paragonimus, we've already talked about that. The Kellycraudia is the one in the United States. Westermani is the one in the Western Pacific, okay? Clinorchus sinensis, Fasciola hepatica, Opus dorsus. All those are obtained through eating fish or alfalfa, and it goes to the liver, causing pretty bad jaundice and liver infection. And Phalaenopsis is the same kind of thing, okay? Okay, now let's keep going. So you've also got, these are the nematodes, okay, which is a roundworm. Okay? Trichinella trichuris, okay, and Capillaria, okay? Strongyloides and Enterobius. Ascaris, Anisakis, Toxocara, Balis ascaris, Ancylostoma, Mercator, Angiostrongylus. There's the different families. I'm not just naming them like that. And I guess we're recording this or not?
Yes.
Okay, good. So y'all can look at it later. Dronunculus, Onchocera, Loa, Diphalaria, Wucheria, and Brugia are all the filarial nematodes. And there's Nathostomia, which you consume through river fish in Africa that's raw or not cooked all the way. Goes through canids and cats, but is really raw, and it can actually causes the worst cutaneous larva migrans you've ever seen. The head of the worm actually has spikes all the way around it. Looks like a thimble with spikes and just burrows to the skin to get out. With that, this is the last lecture for the second years ever. It has been a pleasure to teach you and to work with you. You've taught me a lot. I really appreciate it. I want you to do well. And if you need me, call me.